Hello, my name is Will, and I'll be your nurse for today. So I've been hearing that you have been having some problems with urinating. Is that correct? Oh, really? In that case, it's lucky because I have a order in from the provider to do an in and out cath for you. So what's going to happen? I'm just going to go ahead and insert a urinary catheter up your urethra, get into the bladder, release some of that urine that you've been retaining inside of there. Then with that, you should be able to have a little bit easier difficulty with urinating from now on. So, does that sound okay? Awesome. Okay. So, I'm going to have you tell me your name and date of birth. Awesome. I'll go ahead and sanitize my hands. On clean gloves. And provide privacy. Awesome. So I'm going to go ahead and just open up and expose you a little bit. And then so with catheters, would you be allergic to shellfish at all? No? Okay, awesome. Because the cleaning agent that we use has some shellfish components in it. So if you're allergic to shellfish, I would like to know. Otherwise, are you allergic to latex at all? Nope, awesome, because the urinary catheter has latex in it. So if you're allergic to that, I would also like to know as well. Otherwise, I'm going to go ahead and start getting you all cleaned up right now. Taking my 4 soapy washcloths, I'm going to go ahead and have you open up your legs for me a little bit. Thank you. And then starting from the outer thigh, I'm going to go ahead and wipe off the inner aspect of it. I'm going to go ahead, toss that out. I'll go ahead and grab a new soapy towel. I'll go ahead and wash the inner thigh that's closest to me. Toss that out. I'm going to go ahead and take my 3rd washcloth. Grab the penis. I'll go ahead, wipe off the urinary meatus, changing positions with the towel, then wiping off the other side. So we'll go ahead and toss that out. Using a 4th towel, I'll go ahead and start wiping down the shaft of the penis. Change positions every time I wipe down one of the shaft. Changing positions. Changing positions. Down the underside of the scrotum. Then we'll get rid of that. And then I'll grab one more towel. We'll go ahead and turn you over to your side. And then with another clean towel, we'll go ahead, get it all soapy. I'll clean from the scrotum down to the side of the anus. I'll get rid of that. Awesome. Then we'll get you all laid back down. Then we'll dispose of my gloves. And then right here, I'm going to note if you sanitize my hands before I mess with my mask. Then I'll know if you have foreskin still intact. So at the end of this procedure, I'm going to want to return it to its normal position. And then I'm going to go ahead and start getting my clean, my sanitary thing. I'm going to open it back first, left side, right side, and the side that's closest to me. Make sure it's all like that. I'll go ahead and sanitize. Don another pair of clean gloves. And then with the cleaning agent, I'm just going to go ahead and use Q-tips in place of that so we don't stain the mannequins. So I'll go ahead, Get the Q-tips all clean. Toss that out. So toss that out too. Okay, so then I'm going to go ahead and place the under barrier. That up. Place blue down. I'm going to have you lift up your legs for me. Get that underneath you. We'll cooperate. And now we have that underneath your buttocks, legs. I'll go ahead and get rid of this pair of gloves. Re-sanitize my hands, and then I'll go ahead and apply sterile gloves. So with this, I'm also already wearing eye protection, and then I'm just going to go ahead and demonstrate it on top of the patient. I would not do this in real life. Taking the sterile gloves, I'll go ahead and open it like this, grab the underfolds, and open it all up. I'll go ahead and just reach down, making sure to only grab the inch that's on the outside. Starting off with my non-dominant hand, I'm going to go ahead and pinch the cuff for the glove that's with my non-dominant hand, the innards of the cuff. I'll slide my hand in. Then with this, I'll go ahead and grab the inside of the cuff for my dominant hand. Slide my dominant hand on the inside. Then now that I have my sterile gloves on, I can go ahead and get this glove to cooperate a bit better with my hand. Awesome. Now I'm all finished with this. I'll go ahead, take this and dispose of it, grabbing the middle of it, the sterile side. We'll go and dispose of that. And then I'll go ahead and get my working table over here. Awesome. So now I'm going to go ahead and get everything all prepared. I'll go ahead, open up the specimen container. I'll go ahead and pour some of the lube on the corner of the tray. Then, now that I'm all finished up with that, I'll go ahead and take the top barrier, and we'll go ahead and place it on the penis. And then now I will grab the penis and hold it up, and then since I touched the penis with my sterile glove hand on the left side, I'm not going to go ahead and let go of it. So then I'm going to go ahead and take the Q-tip that has iodine on it. With the first swab, I'll go ahead and clean the edge that's closest to the urinary meatus. Go ahead and dispose of that. I'll take a second swab that has iodine on it. Clean the glands. It's a little bit further away from the meatus. Dispose of that. And then I'll go ahead and take the third Q-tip and clean just a little bit more further away from the meatus. I'll dispose of that. So then, now that I'm all finished up, I'll go ahead and move the jar, or the container, right over into the middle of it all, making sure to place it on the barriers. And then I'll go ahead, take the catheter, dip the edge, or the end that will go into the urethra into the lube, coil it like so, and I'll go ahead and enter it into the urethra. So then I'll just go ahead, keep going. With it. Going with it until it gets to the top. Like that, or whenever urine starts coming out. I'll go ahead and place it in the specimen container, and then I'll just let the urine contents empty itself out. Awesome. Now that we're all finished, I'll go ahead and take the catheter out. Go ahead and dispose of that. Then, so now that we're all finished up here, I'll go ahead and put the top of the jar onto the specimen container. Now it's all screwed on, we're all finished here. So I'll go ahead and take this. I'll note the color, any odor, and if there's any abnormalities in the urine, and I'll go ahead and send that off to lab, and then we'll go ahead and take care of all of this. So since we're all done with the sterile part, I don't need to make sure to keep sterile and everything, so I can go ahead and get some new towels. I'll go ahead and I'll start disposing of everything. Go ahead and toss that all out. This all out. I'll go ahead and remove sterile gloves. Toss that out as well. I'll sanitize my hands. I'll don clean gloves. And then now I'll grab some new soapy towels. Then I'll go ahead and provide peri-care again. Just get it all cleaned up. So with the soapy towel, starting off, I'll go ahead and clean the inner thigh that's furthest from me. Change positions with that. With the clean side, go ahead and clean the inner aspect of the thigh that's closest to me. Get rid of that towel. We'll grab new towel. Now we'll grab the penis, clean the glands, changing positions. We'll go ahead and get rid of that towel. Third towel, we'll go ahead and clean the shaft. Making sure to change positions every single time like I've been doing. Clean the bottom of the shaft to the scrotum. Get rid of that. Then I'll have you go ahead and turn to your side. Take a clean towel, get the scrotum to the anus. Then we'll go ahead, get rid of that towel. We'll help him get comfortable again. See if there's anything else I could do for him since I'm here. And then I'll go ahead and document into the charting. Make sure that the specimen container gets sent up to lab. And then we're all finished.